Okay, so we're going to continue our conversation, this time on the topic of carbohydrates. So, carbs have a lot of purposes. We're going to, of course, focus a lot on carbs as a fuel source. So, a fuel source for providing a supply of energy for our cells. And when I say supply of energy, I mean it in a couple of ways. I mean the energy we need right now to do what we need right now in our cells. So, right now energy. I also mean as a form of energy storage. We'll store carbs for later, meaning we might have the fuel right now, don't need the energy right now. So, we have molecules that are really designed to be save it for later storage kind of molecules. We'll talk about carbs also as cell adhesion molecules, and we'll talk about them in a few different roles, and you'll talk about them in some other roles in your physiology classes as well, and anatomy too. So, carbohydrates have the equal amount of carbon and oxygen, and twice as much hydrogen as carbon or oxygen. So, H2 with a C and an O is the general abbreviation for carbohydrates. They come from carbon dioxide and water through photosynthesis of plants and so on. And the story you've known, I know, since the 10th grade. So the name's derived from a hydrate of carbon. No kidding on that one. And we're going to classify our carbohydrates. So the classification, when you read it, is kind of, okay, whatever. But we're going to use that too. So a monosaccharide is a single carbohydrate unit, a single sugar. And we're going to use that. When we start processing our carbs for energy, we're going to start with a particular carb. We're going to start with glucose. It's the typical traditional place to start. And we're going to take that all the way to ATP through several reactions, steps, processes, and we'll get that one molecule converted to ATP. The analogy I usually use for this approach is one of building a highway. So the real people who build the real highways, of course, build on-ramps and off-ramps while they're building the highway. We're going to improve on that. We think it's more efficient to build the highway itself. So the main road from point A to point B. So say we're building I-95. We're going to build the road from Holton, Maine to Miami. No on-ramps, no off-ramps, nothing besides the road itself. That's the hard part. Then on-ramps and off-ramps are easy. So glucose to ATP is Maine to Miami. Then we're going to say, all right, well, we know glucose isn't the only carbohydrate in the world. It's not even the only monosaccharide in the world. What do we do with others? I'll say, all right, well, we have fructose. What we can do is a couple of steps, a couple of reactions, get a molecule that we've already seen on this main highway and go from there. So all we have to do is do this little on-ramp, get something that we've seen, we're good to go to get to ATP. An on-ramp's easy compared to the whole highway. We'll do that again with another monosaccharide, galactose. Then we'll say, all right, well, that was pretty easy. We also have disaccharides. They're two monosaccharides put together with an ester bond, also called a glycosidic bond, and we'll talk about that. And we'll say, all right, well, we already know what to do with all these monosaccharides, how to get to ATP. All we've got to do is break up the disaccharide, let's say it's sucrose, break that ester bond, and we get a glucose and a fructose. We know what to do with those. So all we need to do is know how to break that di into its monos. Then we're good to go. An oligosaccharide is 3 to 10 monosaccharide units. So we're doing small, medium, large. It's kind of our medium. we can break that down into dis or monos. A polysaccharide is lots of sugar units, lots of monosaccharides. Most of our polys actually get broken down, or most of the polys we're going to worry about, get broken down to glucose. So we have a polysaccharide, we can break it down into glucose, we'll know how to get the glucose to ATP. So it's important, obviously, that you know a mono is 1 sugar unit, di is 2, oligo 3 to 10, poly is more, but use that too, rather than, yeah, it's 1, it's 2, whatever. Think about this when we do digestion. We're going to eat polysaccharides and we're going to digest them. We're ultimately going to get them down to, if it's made up of glucose, into single glucoses. So they can go into the cell and we can make our ATP. But if you kind of look at what we're doing is we're breaking them down, that will add a little more logic to the digestion module that you're going to do later. I'm going to make the poly smaller, maybe to oligos, to dis, then to monos. So you'll see that progression as you go through digestion. So keep an eye out for it. It'll make it easier for you to keep track of where you're going, what you're doing. Okay, so we're going to talk about monosaccharides first. Monosaccharides are really the bulk of the carbohydrate story because everything's made up really of monosaccharides. So once we discuss the structure of the monosaccharides, then the only structure conversation left is really, well, how do we put the monos together to make these larger molecules? So monosaccharides are characterized a number of different ways. By the number of carbons. We're going to do a lot with 6-carbon monosaccharides. We'll break some of them into 3-carbon. We'll have others along the way, but 6 is a big number for us. 3 fairly often. And you'll see some trends that way. We're going to have different functional groups, and let's talk about those for a minute. We're going to have an aldehyde and a ketone. So we're going to spend some time in the next video on functional groups and really get that nailed down and out of the way. But let's talk about those two for a minute. Like we said, a functional group is a name for a particular arrangement of part of a molecule. So an aldehyde is a carbon double bonded to an oxygen, single bonded to a hydrogen, then the rest of the molecule attached. So rather than saying over and over and over, I have a carbon double bonded to an oxygen, single bonded to a hydrogen, we just say we have an aldehyde. Ketone is a carbon double bonded to an oxygen and the rest of the molecule or molecules on either side. So again, rather than saying I'm carbon double bonded to an oxygen, whatever, I'll just say I have a ketone. The thing that's a big deal with this is, in terms of the ramifications with structure, is the aldehyde is a terminal, has a terminal end. I can't attach anything else here. So let's say I had a ring structure or something. The ring structure can't wrap around here. This has to be terminal. Here, it's not terminal. I could even wrap around back to the other side of the molecule. So that terminal, non-terminal idea makes a big difference in some of our structures. We're going to talk about stereoisomers. We'll get to what they are a little bit. Next video, we're really going to drill down on them. We'll talk about ring structures. A lot of our monosaccharides are going to be in ring structures. So a little bit of terminology. We're going to have prefixes, and we'll do some of them now. We'll do some of them in the next video. But we add those to an ending that means sugar, carbohydrate. Ose is sugar. Tri is 3 carbons. Ose is sugar. Tetra for 4. Os again, 5 carbon. Os on the end of hex is 6 carbon. I'd make sure I really do that one. That's a good one to know. Pentose isn't a bad one to know. Os on the end with non is 9 carbon sugar. So the prefix is how many carbons. Os means as a sugar, a monosaccharide. Okay, we've got 2 6-carbon monosaccharides here. I've got glucose, C6H12O6. I have fructose, C6H12O6. Fructose contains a ketone. So I've got my ketone in the middle here. So I could also call it a ketose. A ketone monosaccharide, ketone sugar, is a ketose. Here, I've got my aldehyde on the end. Got to be on the end, but it turns it into an aldose. Let's talk about terminology for a second. So I know I keep saying sugar, and then I'll say carbohydrate, and I'll go back and forth. I'm doing it 100% on purpose. Your task as a healthcare provider, language-wise, terminology-wise, is twofold. You've got to be able to have a conversation with another healthcare provider and talk about carbohydrates and talk about monosaccharides and have all the correct scientific medical terminology. But you also have to talk to your patients. Your patients may be using layperson terms. You've got to be able to speak in layperson terms also. We'll talk to each other about blood glucose. And then you'll have a patient come in and say, well, my blood sugar was high this morning. The sugar they're talking about is glucose, and that's fine, you know that, and they might or might not know that, but it's more of a layperson term. It always gets kind of icky sometimes talking to other scientists. Other scientists hate the word triglyceride. They want triacyl or triacetyl, wherever you're from, glycerol. So triacyl glycerol is the proper term. Well, kind of. Any lab report you ever get, if you get a metabolic profile done, won't say triacyl glycerol, it'll say triglycerides. So which one is proper? Really both probably, depending on the context. So I'll continue to switch back and forth, but I want to be clear on the reason and the task you have ahead of you with that. The other thing is, let's get out in front of some terminology. What I've had some students say to me sometimes when we're in class, when I have this conversation, is, oh yeah, I got to be able to dumb it down. You're not dumbing anything down. It's just a different vocabulary. I tell my accountant to talk to me like he's talking to a 5th grader. I don't know all his accounting words. I really don't care, other than I want to know, what I need to know to make the proper decisions for me and my finances and everything, but don't teach me to be an accountant. So it's not about dumbing it down. I could learn the words if I wanted to. It's about speaking to someone who's in a profession that has a different vocabulary, is probably a better way of saying it. So that's really what I'm trying to equip you to do. Have the vocabulary to talk to another healthcare provider, have the vocabulary to talk to a layperson. So we have our monosaccharides and we have our sugars. Okay, we can switch our aldehydes to ketones or our aldoses to ketoses, and we'll do that. And let me point something out with isomers. I've got C6H12O6 and I have C6H12O6. So we said when we're making an isomer, we're rearranging the components of the molecule that we already have. We're not adding anything, we're not taking away anything. But that rearrangement can make a huge difference in your physiology and what that molecule does, how it does it. So never underestimate your isomer. You'll think, same stuff. How big a difference can it be? Huge difference. So remember we said your whole body processes glucose, so you can use lots of it, only your liver processes fructose. If you take in too much fructose, there's some huge physiological implications of that. Didn't add anything, didn't take away anything. Same 6 carbons, 12 hydrogens, and 6 oxygens, just acting really, really different. So keep that in mind when we talk about isomers. Other thing, don't forget, when we make isomers, sometimes we're making more stable isomers than what we started with. Sometimes we're going to go the other way and make less stable ones. Okay, so we haven't done it yet. We're going to talk about stereoisomers. So what a stereoisomer is a molecule that contains a chiral carbon. So a chiral carbon is one that has 4 different things attached to it. So I'm saying the word things on purpose. So I have a carbon. Let's say, I don't know, I have a hydrogen attached. I have a hydroxyl, and I'm totally making this molecule up. I don't know what it is. I have a methyl group, and let's say I have an ethyl group attached. So let's say I have this molecule, and here's the thing with a chiral carbon. The 4 different things aren't the immediate attachment. So like I have carbon-carbon here and carbon-carbon here. Well, is that 4 different things? What's the whole thing that's attached? Methyl group and an ethyl group. So that's what I mean by the 4 different things. And like I said, when I use the word things, it's completely intentional. But when I have a chiral carbon, one with 4 different things attached, when I flip it over and get a mirror image, the mirror image is different than what I'm starting with. But if I describe it, the description is going to be the same. So it's kind of like, let's say I want to describe my left hand. I'll say, I have 5 fingers and fingernails and however many bones and muscles and all tendons, ligaments, all the stuff. Then, if I want to describe my right hand, I could say the same thing. Fingers, thumbs, nails, muscles, tendons, ligaments. And the description is going to be the same. But is my left hand the same as my right hand? Well, no, they're mirror images. That's what a chiral carbon causes. Makes you a stereoisomer where you have a left version and a right version that if you describe them, they're the same, but they're really not. They're mirror images of each other. You can calculate the total number, you can calculate the number of chiral carbons, you can calculate the number of stereoisomers. We're not going to do that, but we're going to talk about what the relevance of it is. So, like I said, you can calculate chiral carbons, depending on whether it's an aldehyde or a ketone. Go ahead and do that if you would like. I don't think it's that important for what we're doing with the material. But what we're going to do is we're going to look at the relevance of this. So like we said, a lot of our stuff that we're going to do, we're looking at what's in it for us. So when you look at the stereoisomers, if you took the stereoisomer, put it in water, depending on which stereoisomer it is, if you shined plain polarized light through it, it's going to send that light either to the right or the left. If it sends it to the right, we're going to call that the dextro rotatory form or the D form. If it sends it to the left, it's going to be the levo rotatory form or the L form. So it's kind of like right and left hand. It kind of is like right and left in a way. So, in the case of carbohydrates, and let me emphasize, even though we're doing carbohydrates, let me emphasize I'm only talking about carbohydrates right now. In the case of carbohydrates, only the D form is the naturally occurring form. It's going to be different in amino acids. Amino acids, it's going to be the L form. So, if you're going to say, well, D is always naturally occurring or L is always naturally occurring, you got to make sure you're clear on naturally occurring in what. So D for carbohydrates. So very often the name is going to be D something ose, D glucose, D fructose, D galactose, whatever. So in the D form, the chiral carbon furthest from the functional group, either the aldehyde or the ketone, we're conventionally going to write that on the right. So just a convention, but it's typically what we do. Okay, a couple of examples. We'll go through a few examples quickly. Again, if you want to do the calculation, go right ahead. I'll help you. If you want to do it and get stuck, we're not going to do it. I don't think it's important enough to take our time now doing it. But anyway, a couple of aldoses, 3 carbon, triose, 3 carbon monosaccharides, 3 carbon sugars, 3 carbon carbohydrates, saying the same thing. Aldoses, glyceraldehyde, and we're going to make glyceraldehyde. 3 carbon triose, we're going to make that too. Dihydroxyacetone phosphate. We'll abbreviate it, and we will make it. Some tetroses, both an aldose, we're both aldoses. Some pentoses, we'll see those, particularly ribose. Ketose, we're going to see that too. We're going to actually make ribulose and make ribose out of it. But we'll be doing that next trimester. Hexoses, we really, really like our hexoses. So you'll see these fairly often. Glucose, our D-glucose you're going to see. Galactose you're going to see. Fructose you're going to see. We'll do a lot with fructose too, both chemically with our reactions, making it. We're going to talk about it physiologically. A lot of conditions that plague a lot of people can be attributed to an overconsumption of this particular ketose, fructose. Our monosaccharides, in a lot of cases, are going to be turned into rings. This is where you're going to see a little bit of a difference depending on whether we're starting out with an aldehyde or a ketone. So when we make the aldehyde, or use the aldehyde and make the ring, we're going to have 1 carbon sticking out. So we'll have that 1 carbon sticking out of the ring, and our oxygen, of course, is part of the ring because of how we make it. When we have a ketone, we're going to end up with 2 carbons sticking out, just because of the way we make it. So we can end up then with either a 6-membered ring or a 5-membered ring. Let's talk a little bit about anomeric carbons. And again, we're going to talk about them in terms of what's in it for us, what's the relevance to us. So if we have an anomeric carbon, it allows the sugar to reduce, something called Benedict solution. If we had a lab, we would do it. But if it's able to do that, we call it a reducing sugar. So again, we don't have a lab. I guess you could probably see it on YouTube, but we'll talk about what we're going to do with that. So what it's going to give us is an alpha and a beta form. So carbon 1 is next to the oxygen. Carbon 1 is next to the oxygen. Depending on whether the hydroxyl group is drawn up or down, that gives us the alpha or the beta form. So if it's down, this is our alpha. It's drawn up, this is our beta form. Dextrose is a mix of alpha and beta D-glucose. And there's some relevance there, kind of. One of the things, a patient education lecture that patients are usually pretty into, if you decide to do that in your office, is the one on food labeling, helping them read food labels. One of the things that really usually surprises them when you're doing it is when you tell them about food labels, like the first thing on the label is the thing that you have the most of in that food. Second thing is the second most quantity-wise, third thing, and so on. So if you want to be a little deceptive in the food labeling, let's say, I don't know, I just made this great sports drink and I want to present it as healthy, but I really want everybody to want to drink it and buy it and everything. So I want it to taste good, so I'm going to fill it up with sugar, but I don't want to show that on the label because I'm pretending it's healthy. What I can do is divide that sugar among a bunch of different names for sugar, whether it be like glucose and fructose together as high fructose corn syrup or sucrose, or a whole bunch of glucose. And I think there's, I don't know, 30, 40 different names for just plain sugar. So if I start dividing my sugar among all these different names, I can move it way down on the food label. So when you see dextrose on a food label, all that is glucose. It's a mixture of the alpha form and the beta form, but nothing different than glucose. So it's one of the things that comes up. I can divide it, put part of my quantity in dextrose and move it down on the label. Anyway, just a thought as you're thinking about your future office and everything. So my D-glucose, I have that hydroxyl down for my alpha form, up for my beta form. Okay, we have some other epimers too, and we're going to talk about some of these isomers. So depending on what carbon we're making the change at, makes it different sugars. Galactose is one that we'll be talking about. We're moving the hydrogen and hydroxyl around a carbon 4, makes us galactose. We're going to get that from the disaccharide lactose from our dairy products. Okay, next up is going to be disaccharides. Di is 2. We're going to have 2 monosaccharides put together. Okay, really important that you know what monos make up what disaccharide, or for each disaccharide, what monos. So the first one we're going to talk about is sucrose, plain old white cane sugar. And it's one we eat a ton of. So what it's made up of is a glucose and a fructose. So really important that you know sucrose is glucose and fructose. And it's formed by a glycosidic linkage. So it's an alpha 1,2 beta glycosidic bond. So all a glycosidic bond is a plain old ether, an oxygen connecting a carbon 1 to the carbon 2 and all that. But when it's sugars, we'll call it glycosidic. What you're going to notice very, very quickly, probably next try, is all the GLU and GLY words we're going to be talking about in the context of carbohydrates. When we first start doing that, you probably think, oh, this is kind of convenient. Everything's sugars, GLY, GLU, easy. Except they're going to multiply so quickly. So I'm going to start kind of staying after you. If it starts with G, write out the whole word, because you'll have so many, and at this point I can pretty well tell you what week they're going to start blending together on you. And when you first start, you think, oh, I can remember glucose 6-phosphate, whatever. A couple weeks after that, we got glycerol 3-phosphate, glyceraldehyde 3-phosphate, and just all these GL, everything's blending in your head. So it starts with G, write it out. So anyway, sucrose is glucose and fructose attached to each other through a glycosidic linkage, glycosidic bond. Just as an FYI, probably more important for nutrition class than for us, or definitely, high fructose corn syrup is glucose and fructose in roughly equal proportions. Difference being, though, they're not attached to each other. So physiologically, they act very similar in some ways because they both have glucose and fructose, but high fructose corn syrup is not a disaccharide. So our source is table sugar, cane sugar, whatever, just plain old white sugar that's in everything. It's a non-reducing sugar. Next one's lactose via dairy products. This one's made up of a galactose and a glucose joined by a beta-1,4 glycosidic bond. So again, I'd be really sure I do lactose. Came from attaching a galactose to a glucose through that glycosidic bond. It's from dairy products, milk, cream, stuff like that. It's actually our only animal source of carbohydrate. Last one's maltose, two glucoses. So it's a glucose attached to a glucose through an alpha-1,4 glycosidic bond. Plain old ether attaching carbon 1 to carbon 4 of two glucoses. From malt sugar, I'll hear students sometimes saying it's my beer molecule, malt beer, just as a goofy way of remembering it. But if goofy ways help you remember stuff, by all means. So make that by breaking down amylose in the mouth. We're going to do that. I wouldn't worry too much about it yet, but I'd absolutely know maltose is my two glucoses. Okay, next place we're going to go is polysaccharides. And the polysaccharides we're going to talk about first are a whole bunch of glucoses hooked together. So the first one is starch. It's a bunch of glucoses hooked together by glycosidic linkages, and we'll talk about what carbon we're linking to what carbon in a few minutes. It's a polymer of glucose, sometimes called a glucosan, not an awfully common term, but from cereal, potatoes, vegetables, stuff like that. We can have, let me see if it's on, yeah, I can remember if I broke it out into other slides. We can have a linear molecule that's all glucoses hooked together. So I have a glucose, I have a glucose, I have a glucose, I have a glucose. And I'll tell you in a minute why I'm very casually saying hooked together. Linked by our glycosidic linkages, linking carbon 1 of one glucose to a carbon 4 of another, a 1 to a 4, 1 to a 4 again. So really important that you know amylose is made up of glucoses, non-branching, or probably easier to remember and say, it's a linear molecule. So it's a plant starch. We also have amylopectin. Plant starch, part of it formed from 1,4 glycosidic bonds, part of it from 1,6. So this one's a branched molecule, and the way it works is like the main part of the branch, not sure how to draw it, like one glucose to another to another. The linear part of the branch is made from 1,4 bonds. So 1,4, 1,4, 1,4. Then, when I want to make a branch, I've got to do a 1,6 to another glucose. Then I'll go back to 1,4s again. And we don't make this, it's a plant molecule, so I shouldn't be saying we go 1,4, go 1,6. But the base of the branch is a 1,6. So when it can be a 1,4, it is. When carbon 4 is used, occupied, whatever, then we go to a 1,6. So like this glucose already has carbon 1 attached to something, already has carbon 4 attached to something. So now I've got to use carbon 6 to attach to something else, to another glucose. So that's our amylopectin, another plant molecule. Here's glycogen. We make it. So this is something we make, animals make, other animals, I guess we're animals. And it's the same kind of structure, kind of. And what I mean is the main part of the branch, didn't mean to do that. Didn't know my links were live. My links are not getting live. Let's go back. The main part of my branch, like if I'm going glucose to glucose, that's going to be a carbon 1 to carbon 4, like we said before. Then, when we want to make a branch, we have to go 1 to 6. Then we go back to 1,4. And when we're talking about this in class, we make it. It's our storage molecule for carbohydrates. So next trimester, we're going to talk about making it. And the beginning of the story is going to be, I ate a whole bunch of carbohydrate and I don't need it all right now. So I'll make energy out of what I need right now, and I'll save the rest of it, the rest of my extra glucose or my extra glucose, I'll save it for later in the form of glycogen. So I'll make glycogen. So when we're talking about it, we'll talk about it like I've got a whole bunch of glucoses and I want all my glucoses holding hands, but I want a branched molecule. So the main part of the branch, we can go hand to hand, hand to hand, hand to hand, and so on. But then when it comes to this one that I need to hold another glucose's hand, it can't. One hand's occupied with that glucose, one hand's occupied here, it's going to stick its foot out. And then this glucose can hold its foot. But no one wants to hold anyone's stinky foot. We're going to go back to hand after that. So using carbon-6, holding somebody's foot's the last resort. You don't want to. You're only going to do that if you have to. You'd rather hold their hand. So just the intersection of that branch is the 1,6 bond. So it's a little deceiving when we say branching, alpha 1,6, just the base of the branch. So that's the bonding story, and we'll come back and we'll talk about that and what enzyme makes what bond and everything when we get there. But the other thing with a branched molecule, before I get there, my first thought would be, all right, well, what's the difference between amylopectin and glycogen? Other than plants make amylopectin and animals make glycogen. That's part of it. On glycogen, we have more branching. So it's kind of a denser molecule. We do more branch sooner, I guess, might be another way of saying it. So that's the structural difference between the two. The other thing is, let's talk about the relevance of a branched molecule. When we talk about glycogen, we're going to talk about speed. When we make glycogen out of extra glucose, we're going to do it fast. It's about doing it fast. When we break down glycogen to get the glucose, we want that glucose fast. We need it now, not later. So the branching is really, really convenient for us because if it's branched, I could be putting a glucose, I don't want to get too close, get that link. I could be putting a glucose on the end of every one of my branches all at once. And of course, picture it in 3D. Or if I need glucose right now and I'm breaking down glycogen, I could be getting this one and this one and this one and this one and so on all at the same time. So branching in a molecule very often is our speed. Okay, we're going to put glycogen in two places primarily. So some of our glycogen is going to go in the liver. Some of our glycogen is going to go in the muscle. And they're both going to be for storage of extra glucose, but they're going to take care of two very different things. We're going to say, or you're going to hear me say a lot with muscles are really self-centered little creatures. They care about one thing, themselves. So when we put glycogen or make glycogen in the muscle, it's for one thing, the muscle. The blood glucose levels could drop and the muscle is going to say, too bad, not my problem, I'm good. But the liver is different. The liver is like everybody's mama. And I'm going to keep saying that because it's true. The liver takes care of everybody and cleans up after everybody, kind of like everybody's mama. So one of the ways in which I mean that is the liver worries about blood glucose levels. So the liver worries about blood glucose levels. Well, where does the blood go? Everywhere. So that's what I mean by taking care of everybody, all the tissues, everywhere. So when we start talking about glycogen, the stories are going to divide a little bit in a way. We make it the same molecule, all that, but in the muscle, it's going to be about activity. If I'm doing something like exercising, I need glucose, so I'll break down glycogen to get it. And in muscle, it's kind of the extra boost. I can't necessarily, depending on what I'm doing, get enough glucose out of the blood fast enough to do what I'm doing. So I need that extra boost of my glycogen stored in there. In the liver, because what we're worried about is blood glucose levels, the story is usually going to be about eating or not eating. I ate, I have glucose in my blood, I can take some out, store it for later as glycogen, or I didn't eat, and if I don't do something, my blood glucose levels are going to drop, and I don't want that, so I'll break down some glycogen in the liver to bring my blood glucose levels back up. So we're going to be telling a lot of stories that way, and it's kind of the place in metabolism where you see our stories very dramatically start, or our questions really, I should say, very dramatically start dividing between nitty-gritty, what enzyme catalyzes what kind of questions, and application. You've been running, you've been eating, not eating, whatever, what's happening. And we'll practice those and go through them and everything. The other thing with glycogen, it's a finite resource or a finite thing, meaning I can max out my glycogen. I can't just keep making and making and making glycogen. At a point, the liver or the muscles say, that's it, you're done, I'm full, I'm good. And then you'll take the extra fuel and go and make fatty acids, triglycerides, send it off to the adipose tissue, make fat, get fat kind of thing. So that's a uniqueness with glycogen as a storage molecule. It's our short-term storage. And it's finite. We can cap it, we can max it out. Okay, cellulose is another non-branching molecule made up of glucoses. Still a 1,4 bond, this time it's a beta 1,4 bond, which we can't break down. So we can break the alpha, we can't break the beta. Since we can't break that beta bond, we can't digest it. We can ferment it by some of the bacteria in the GI tract. Some animals, like cows, can break it. It's a molecule found in plant walls, things like that. So we can have insoluble fiber, we can have soluble fiber. I'm going to leave most of this conversation for Dr. Krabbe in nutrition, because when he's doing nutrition, it fits much better in a much more relevant way in the middle of his conversations. So we'll just talk a little bit about it. I'll leave the bulk of it for him. So we can have soluble and insoluble. The insoluble bulks up the stool, things like that, slows the transit time through the bowel down, allowing you to resorb water, things like that. The soluble gives you the feeling of fullness after eating, so makes you want to stop eating. There's also hormones that say, enough, you're full, quit there. It's also thought to have some protection against cardiovascular disease by some researchers. So do your research on that and decide for you how much of a protective effect, how significant is that. And something just quick with that, there's a few places where I'm going to say things like that. Here's the problem with the doctor thing that you just signed up for. There's not an algorithm for everything. It'd be nice if there were, my low back hurts, do this, nice and easy. It doesn't work that way. There's an awful lot of judgment kind of calls, so you've got to do your research to be able to make those judgments. And I don't remember if I said this before in other videos, but I think it's important enough that if I did, I'll say it again. Here's the thing with the research and opinions and everything, and I did say it in DNA, but do your research and form your opinion. That's easy enough. Don't forget to allow yourself to change that opinion as you do more research. It's fine. You just learn more stuff that made you form a different opinion. It's not saying you were wrong, it's just saying you learned more stuff. So do your research and form your opinions, and those opinions are going to affect how you manage your patients in a lot of cases. So that's why it's so important that you do it, stay on top of the research. Okay, the RDA for fiber, I'm going to leave that for Dr. Krabby in nutrition. We're talking about polymers of glucose, and we're going to keep the majority of our time and our focus on those. I just want to bring up a couple of others just so I don't give the impression that glucose is the only monosaccharide that does form polymers. Fructose also forms a polymer that we find in artichoke roots, onions, bananas, things like that, called inulin. We can have fructo-oligosaccharides, so the short polysaccharides of fructose, and your intestinal bacteria kind of likes them. They're a oligosaccharide that sometimes you'll supplement with to be able to have better gut bacteria. It's sometimes used as a natural approach to antibiotic therapy. Not super effective, according to some researchers. Jury's out on that one. Okay, cell adhesion molecules. I think some of this we're going to do in some separate videos. But let's talk a little bit about glycosaminoglycans. So, glycosaminoglycans are long, unbranched polysaccharides. They contain modified disaccharide units on repeat. So, we have an amino sugar and we have a modified sugar. So we're going to have, depending on what combination we have, we're going to have different glycosaminoglycans. So let's talk about those for a minute. And these are molecules you're going to see in a lot of different classes. I don't know if I can enlarge. Nope. Nope, not going to let me enlarge it. Sorry. Okay, thought I might. All right, so let's talk about them briefly. And like I said, you're going to see them in different classes. So one of them is chondroitin sulfate. We can see what it's made up of and everything here. It's your most abundant glycosaminoglycan, part of the extracellular matrix, connective tissue, cartilage, tendons, bones, things like that. We have dermatan sulfate. This one's the extracellular matrix again, skin, blood vessels, thought to have an antithrombotic function. We have heparin. Heparin can have different amounts of sulfur in it. This one's a natural anticoagulant. When we talk about mast cells and everything, we'll come back to it. Got another one, predominantly in the umbilical cord. No sulfur, not bound to our protein. We see it in synovial fluid. We see it in the vitreous humor of the eye, places like that. Oops. So again, our glycosaminoglycans, also known as our GAGs. Then we have our proteoglycans. So our proteoglycans are kind of interesting molecules. They're also known as mucopolysaccharides, also known as snotty sugars. They're kind of a sticky molecule. They have kind of a cushioning effect in a lot of places. So what these guys are, the diagram's not very good. We've got a core protein. And what we have sticking off the core protein here and there is we have a glycosaminoglycan. So what it makes is kind of a bulky molecule. It can absorb lots of water, part of the extracellular matrix, but that gives it the lubricating, the shock absorption, that was the term I couldn't think of, the shock absorbing kind of properties. We'll say it has a bottle brush appearance because of the glycosaminoglycans sticking out off of it. Okay, that's as far as I wanted to get with carbohydrates for now in terms of structure. And like I said, you're going to see a lot of them in different roles in physiology, things like that. So I think the next place we're going to go is we're going to do a little bit of a chem review, tying some of this together, and we still have to do lipids. But I want to hit the functional group so we can get that conversation out of the way in a way. And some of the other little details, getting everybody on the same page in terms of chemistry knowledge, organic knowledge, nomenclature, things like that. So we'll do that next. Then we'll move on to lipids. While we're doing lipids, we'll talk a little bit about cell membranes, things like that. We'll bring a lot of these molecules back in then later, next try in the conversations about metabolism.